بالشكل هذا امسكها من هنا.
كيف البيشنت يقدر يحدد السيف هذه؟
هي من الميدل يحدد.
لا ما حدد، بس انت تحطها في
يعني
الكيف
غالبا
هذا.
منتصف.
تمام. هذا البلت
اوكي
عكس
العكس.
ايوه
اوكي
هذا بس يقبل
تسحب. فرقة البلت اريح لانه انت تسوي كنترول لنفس الوقت.
طبعا المنشفة نفس الفكرة. هذه 7.
هذه بين اللي هي 7 6. هذه بين السادسة والخامسة. هذه الخامسة والرابعة تقريبا.
خلينا نشتغل على الخامسة والرابعة.
طيب إذا كانت بين الخامسة والرابعة معناته نجي من تحت اللي هي الخامسة. إذا الخامسة والرابعة نجي من تحت اللي هي الخامسة بالشكل هذا. إيش الفكرة؟ إنك تلتتر
والبيشنت هو بيسوي
فليكشن اند ريلاكس.
برضه هنا دكتور
اوكي ارتاح. فليكس اوكي ارتاح. فليكس فليكس.
الرابعة والخامسة حجي من الرابعة.
لو كانت الرابعة الخامسة حجي بلو الخامسة. الفليكشن عكس حجي بلو الرابعة. عكسناها أول ترى.
أول عكستوها.
في الفليكشن حجي من تحت الرابعة. إذا كان النرو بين الرابعة والخامسة حجي تحت الرابعة. نفس المنطقة. وكنت بسوي فليكشن. إذا كان في الإكستنشن أبغى أسويها أجي من تحت الخامسة
عشان ترفع الفقرة.
بالضبط. هنا نبغى نجرب الآن الإكستنشن. اوكي اكستند اند ريلاكس. الان نبغى نسوي بالبلت بالشكل هذا.
طبعا هو ما يعرف
السحب 45 درجة لفوق. لا كذا. ايوه امسك من هنا عشان اريح لك.
دقيقة احنا سوينا الروتيشن الحين الفليكشن صح؟
ايه عندك الفليكشن. امسك من هنا كذا على ثابت. ارفعها لفوق تقريبا كذا. مقدم رقبتك. يلا اسحب على فوق. اثني اللي قدام وانت ساحب. اثني وارجع لفوق. اثني ارتاح. اثني ارتاح. هذه بين تحت الرابعة إذا كان بالفليكشن. تنزل تكة تحت الخامسة إذا كان بالاكستنشن. على فوق
نفس الزاوية بالفليكشن
45 درجة. اكستند ريلاكس. اكستند. لا هذه 45 درجة. يعني لازم يكون مستوى هو زي ايوه. اسحب. هذه لازم كلها تكون بين فري.
تحدد الفلوس. الثانية
حددتها.
لا خلاص سيب سبر هنا.
هنا
حط الكوع هنا.
يروح بنت.
ايوه هنا كوع. ايوه
هنا الكوع صح؟
تمام.
هذه كذا.
هذه بس كذا مع الكوع. انا الضغط شوي.
لا هي سواها مثل
فخر شيء.
هذا مسواه رجل.
نشوف.
هو ترى راح الار 2 حسيت انه خلاص.
انا اقول لك انا
اوكي يعني ساوى سيستين الموفمنت بعدين اعطاها
المانيبيوليشن في جريد 5. انت
انا ما حيطق عندي خلاص انه مره واحده اشوف لك واحد ثاني واجرب الاول.
الطق
الثاني هذا طق لانه اول كنت تضغط كذا.
ايوه انا بس قال لي الرب تخليها هنا.
بالضبط ميديال.
هذا الرابع
على جوا تحت الرابع.
يلا اكشن.
دور داي مع الفيشن ننزل انت تروح مع الصبح لا تنزل صباح يا بس
الاكستنشن تنزل تكه فقط نفس الشيء.
تحت الفقرة مثلا اذا كنت ضغط خمسة في الاكشن لا تحت الرابع.
So this patient is saying that when he drinks cold water, he feels the pain shooting towards the upper jaw like TMD or going to the spine, to the cervical spine. And this is one of the last classifications that I talked about it last time, that we have cervical spine, spondylosis without blah blah blah. One of them is if it is related to the TMD, the temporomandibular disorders. And is when he drinking the cold water, maybe tooth problems, activating the nerve, and the nerve causing referred pain to the neck. So, so it's one side, referred pain to the neck. So that's not related to what I'm testing him for. So first thing that you need to stop and refer, that's not really to stop, but because it's not very major issue, but you tell him that you have to see the dentist as soon as possible. That because this is the dental problem, so you have to see that. But when I tested him, he has very severe limitation of C6 on 7 and 7 on T1. That is like a little bit slightly forward head posture, but it's stuck. It's not moving in there at all. So there is a good mobilization technique. We can use it for this person. We did also the rotation, right? We did the rotation, flexion, and extension. So give me a chair right here for this person. Your name is? Abdul Mohsen. C7, T1, C7, T1. C7 and T1. If you free this area, if you free it nicely, you're gonna get good results. One, you have to teach the patient who's can help this patient here in this facility. Being can. You can help him? All right. So he needs a lot of education for the postural assessment because his forward head, so we need to teach him how to chin tuck and do the shoulders, so posture correction exercise program. And you need to be consistent with it to do that, to make good results for this part. The second part, here is C7, here is C7, and here is T1. Take it right there. Here's T1, right? C7, T1. These two are stuck together. When he bend forward, they go together. When he comes down, when you rotate, they're rotating together. They are like very good syndrome of the posture derangement that's causing that problem. So what our job is to free these two, to unlock that connection between both of them. So if I use that from one side to the other, so my hand is going to come this way and I'm pushing them away from each other. It depends. If I push that 7 this direction, so the patient will rotate to the left. So I'm going to go one time to the left. So I'm going to push the T1 this direction and move C7 to the opposite direction. and then I'll switch. You move that this direction, I'll move that to the opposite direction. So you could right rotation, and you do the left rotation. Whatever way to start with, doesn't matter. His symptoms is on the right side, so I'll start on the right side. So the right side, so here's the C7, T1. I'm gonna come to T1, tuck my hand under it very nicely. So it's like a rock here, it's not moving at all. So I'm gonna put that right there, and I'll put the other one on top of it. And I have to force it now. It's not painful, by the way. And the patient will feel good after you do the therapy. So you move them together, and then ask the patient to rotate to the right. Lift recipe to the knee, and go back. And do it again. Just when you go back to here. Okay, Tani, and go back.
Direction down.
Tani, it's transverse. It's transverse. So you're pushing 7 to this direction. The vertebral body goes this direction. You go into the right rotation. Go right there. Go to the right. And relax. One more. And one more. And relax. One more. And relax. I'm gonna switch. So switch right there. And المرة دي تروح للناحية الشمال. And back. Remember? And back. One more. So that's one part of it. You got a free C6 on C7, doing right rotation, left rotation. You do transverse. This is transverse. This is pushing the spinous process to one direction. You're rotating to the opposite. Right? Good. Now, لابس حاجة في الرجلين. لابس. طب اقلعها.
لابس فانيلا لابس كده.
يلا يلا.
يلا كده.
لابس حاجة على الفانيلا؟ اقلع الفانيلا. So yesterday we did some of the thrusting, but this patient we're going to start with thrust because I did full evaluation, so I'm not going to jump into thrusting. But you should also free the upper thoracic because C1, C7, T1, we can free them by transverse motion. I need to do PA on the four levels from up here to the PA for that. I start from here. This is T1, T2. My pisiform is not going to be on the bone, so it's going to be distal to it. And the actual distal to it right there, you have here the hook of the hamate, and you have a ligament between the pisiform and the hook of the hamate. It's called pisi-hamate ligament, and there's a tunnel here, and there's a tunnel of Guyon. If you remember your anatomy, there's a tunnel of Guyon have the superficial branch of the ulnar nerve. So the people that they use their hand as a hammer, they may have some symptoms like look like the ulnar nerve symptoms. Compression. That's the anatomy. So that you get to that area right here between the hook of the hamate and between the pisiform, and you press that on the spinous process. Because this table is not high-low table, my hand should be this position. The best position my hand is to be in this position, straight, and you go straight on it. This is the best position for me. But I can go that to here, right? So I'm gonna adjust the position, put this right there, here, and I'll get my elbow to be straight on top of it. And I'm gonna tuck my hand on the table, so I'm gonna get support right there, and I'll start here, and I can do grade 1. Pick up the slack first, pick up the slack and then do grade 1. And then I can do grade 2, again grade 2, and then you can grade 3. Grade 3 is going 50%, relax, and you can get grade 4. So and that you get good relief for the upper thoracic. If you're treating cervical, do that for at least to mid-thoracic level, at least. It's better to do it for the whole thoracic. And that's very easy. If I can go like grade 1. See that? I'm moving from one level to the other. And then I'm going to get grade 2. You doing good? You okay, Abdul?
اوكي محسن
محسن
شفت اللي بتجيب لي
نسيت اقول امبارح.
all right grade 3 is that painful is it painful
لا لا بطاز. انا بس.
all right grade 4 كده
انا كنا كده واحد رجلي.
في ألم هنا أكتر؟ أكتر هنا فوق ولا فوق؟ أكتر هنا. So that's most of the things right up here. So the patient said that these are the most painful area, and this is one we're going to concentrate on the upper thoracic. So we're going to concentrate on here, get to grade 4 and grade 4. The oscillation 3 times, and then examine the range of motion and do it again. So if I do like this one, I'm gonna get one level because you do multiple levels here, so you're gonna do several times. So like here's 3, 4. I know it's 3 because of the superior angle of the scapula, so I know my landmark, so I know exactly. I don't have to count 1, 2, 3. Here's the superior angle of the scapula. I'm on 3. Right here's the spine of the scapula. I'm on 4. Here's the inferior angle. I'm on 7. Right? I know what is exactly. So right there, and I am doing grade 1, grade 2, grade 3, and then grade 4. I'll do another level, do the same. I can go back again and do it like between 5 to 10 minutes. The patient will be great with that, right? This patient improved with that, well and good. If not, I'm gonna apply a little bit of higher level of manual therapy. Good. Doing more. All right. So we got that. Patient's improving, getting well and good, but it's not really 100% cured yet. So turn to the other side. Keep the chair. Keep that seat with the moment. Put your hands behind your head. Hands behind your head. Right there. All right. So we're still at the upper thoracic level. Upper thoracic, this area right there. I'm going to bring my hand from here and put it on back of his head. Bring my hand from here and put it in the back of his head. I'm in control now, controlling him, and do whatever I want to. Put my fingers together, get stronger, and get my shoulder to the area that I need to manipulate. And my legs down here, hold it, and I do that thrust technique. It's thrust, one time. Okay? Got it? Easy? Easy to do. Yeah, if female to male, feel free to put a pillow between you and the patient. Or if you need to concentrate an area, you can get a pillow between you. Also undo that. You can use the pillow between you and the patient. Very good. Can be used for fixing.
Thrust technique.
You can use the pillow also for fixing the pillow I want to.
Yes, you can localize.
Yeah.
Localize. Change the chair. Stand up. Stand up. Stand up. Go on. Go up here. ايه؟ يا انت بقى شغلك انت هصلحه. هيصلحوك كده انتوا. حضرتك اللي صلحتني. So this patient needs a lot of postural correction exercise program, and things that we did today, we do it with him. كان في سؤال على first rep again. So we'll do it one more time so we can move on. So I'm treating the left side. You palpate first, see which one is higher than the other. Here, he is really have the left side is higher than the right. So if one, some of you, not too many, 1 or 2 can come and palpate. If you like to come and palpate. Anyone? Come here. Yeah. If you ask him, you can touch him. These are the muscles. So easy. And just put your hand right there. Right. See that the rib is a little higher on the left side. Okay. Next. Can you see the difference? That's right there. See the difference? The right is lower and the left is higher. Between here is the base of the neck, and you are right there. The clavicle is far from you, right there, and right here. You can do that from supine position as well, but it's no time to show all the positions. Right here, so I'm gonna support to relax the scalene, right? And I'm gonna put my hand to relax the head, this direction, slight rotation to you. عشان يبصوا هما ما بيحبش يبص الناحية دي عشان هنا خطر يبص الناحية دي right it's a side bending to the side that you're manipulating to, rotation to the opposite side, turn to the opposite side. Your hand here is stabilizer, not mobilizer. This is the mobilizing hand, comes this direction. So the MCP is touching the first rep, MCP, and you go to R2, and you do high velocity, low amplitude. High velocity, low amplitude. Right here, hold it. How's that? Good? ممتازة، صور مبسوط.
انا عندي اقتراح. كان ممكن تتحل معي، انا مش ما اقدرش ارفعها، بس انا اتحدى ان انا ممكن ارفعها. ايه الفرق؟ ان لا استنى بس اقول لك الفرق انه مش على السرير على الارض. يعني على الارض بس لان ممكن يكون عندي فوبيا خايف اطيح من السرير.
Very good point. Very good point. You start if the patient is not able to go to the ground. You start with the table, or you have the white table, the mat. Okay. Go back. Good point. Good excuse. Lift your right arm up. Now slowly extend your left arm, left leg. Left leg. Don't touch with the.
I hope you have العضلات وبتاع
ما شاء الله تبارك الله.
As straight as possible. Good. And see, the first time the patient may not be able to do it, and gradually will be able to do it. Do the other one.
عمره ما وقع ما شاء الله تبارك.
ما شاء الله شكله
Alright, so you activate the multifidus and the rotators, and you get the patient with some other core muscles. So you are familiar with that, you are therapists, you break with that, go ahead and set it up. And we were treating this patient because of the mid-thoracic tightness, right? And we tried with manual therapy technique, with manipulation technique. We tried with the manipulation, we thrust someone here, right? We tried on the chair and we did that exercise, the manipulation. Good. You get them home and you buy them one of these. Sell them one of these for $20, 20 riyals, all right? And get the patient to go on that back of that. I want you to put your hand behind your head, right there, and bend your knees. Now put the scarf there, and I want you to roll over it till you get to the point that's very stiff and painful. Right there, very good. You get to the point that's very stiff and painful. Spread your arms and try to go down on top of that all the way. Feel that? Is it painful? Painful. See that is not able even to do that. And go back. Try again. Why is it painful? Is that too tough for me? Try again to change the position. So that's the good about that, you can change up and down till you get a comfort position. What? No, you can support that. Doesn't you do bridging? Does it? Stop. Right there. Push it too much on it. So you can reduce that and find another position. and you do that again. So you can find where exactly you can put that on. Very good exercise to open the other parts of the body. Start from flexion, and I will do the other side, and I'll do the hat finish. كل شوية تتعمل right? The ULTT test. Are you with me? Come here. What's your name? تعالي يا ليلى. كل يدعي وصلا بليلى وليلى لا تذكر لهم بذاك. So Layla said that the neck pain is not coming, the pain that's coming in the hand is not from the neck, it's from the nerve. It's from the nerve, right? So I'll tell her, let's test the nerve. So we'll test the median nerve. Testing the median nerve will differentiate if that numbness and tingling coming from the neck or from the peripheral nerve. The peripheral nerve may be getting tight, maybe while it's going from median. You know the GPS of median nerve, where it's going? How to go to the highway and go which direction that they go, come from here, between the biceps and triceps, and right in this groove, and right there, and come right there. I'm also certified to do EMG nerve conduction, so that you have to know the nerves exactly where they go, so you can test that. So this is the median nerve that we're testing. You depress the shoulder, so depression of the shoulder. Why you depress the shoulder? أنا بكلم ليلى. قول يا ليلى. So now to pull on the brachial plexus, so to pull on the origin, right? You pull that. You depress the shoulder. So you depress the shoulder and you put that in 110 and you do that in supination and you get the fingers and the wrist into extension. Now we'll start to test. Start testing from flexion into extension. And we'll ask the patient to report any pain or numbness across that movement. If the patient reported right there, I'm going to report that, document that at 90 degrees, at 45, whatever it is, right? But you have to keep that compression all the time and mean that.
Is it similar to nerve mobilization?
And get that all the way. All right. Concentrate on it. Hey, stop. صوتي راح خلاص مش قادر أزعل. If the patient is not able or not reporting any signs and symptoms, هنعمل إيه يا مان؟ We need to stretch more. نعمل إيه؟ So you get his head. You get his head to the side, right? And you can keep that depression. So you're increasing the tension on the brachial plexus. You good? Okay. So right there, and then start again to test that, and tell the patient to report any pain, numbness, and tingling. Most of the patient will tell you, "Yeah, I feel it right there." That is muscle tension, not what we're reporting. It has to be positive. If the patient report numbness and tingling, increasing the nerve distribution. But if the patient said that, yeah, it's very tight in there, that's muscle tightness. Yeah, we deal with it differently, right? But if this patient, what's your name? Ryan. So Ryan has that numbness and tingling at the periphery. When he reported at this ear right there, right? I may maintain that position and then start to do nerve flossing. Nerve flossing. So I'm going to come right there.